You're good.
Hey everyone, this is Dr. Pink at Diamond Creek Farm. Just wanted to introduce you guys to our newest addition here. This is a Captain Treacherous filly out of the mare Fine Art. She was born last night at about 11:45 p.m. And what we're going to do right now is we're going to do a postpartum exam on the mare, just a physical exam on the mare to make sure the mare is healthy. And then we're going to move on to do a new foal exam on the filly to make sure that she is healthy. So getting started, we always start with the mare first so she gets used to us being in the stall and around the foal. This mare, this is her first baby that she's had, so she could be a little anxious and fractious, so we're just gonna go real slow with her. First thing I do is I listen to her heart, want to make sure that she has a normal heart rate. Then I just move on to her lungs, just part of a normal physical exam. Then I move on to listen to her gastrointestinal sounds, her GI sounds. I want to make sure that her intestines are moving well. That baby was taking up a lot of space inside of her abdomen, and horses can have issues after they foal, not wanting to pass manure, and sometimes their colon likes to move out of place. So I just want to make sure everything's moving okay. And it is. And then when I'm back here, I'm going to take the temperature of the mare. I want to make sure that she doesn't have a fever. And when I'm back here, I'm also going to look at her perineum, which is the space between her anus and her vulva, to look for swelling, and she is very swollen back here, which is not surprising. Maiden mares, when they have their first foal, it's usually a little bit of a tight squeeze, and they're not used to it, so they get a lot of swelling, and she has a lot of swelling back there, the poor girl. We'll get her some Banamine for that. That'll help with the swelling and make her feel a little bit better. Normal temperature, which is good. I always check for digital pulses too, just to make sure that they're normal. You feel for them on the back side of their fetlocks. Feeling for digital pulses is an indication if you're looking for things like founder. Having a foal is a traumatic event for horses, and so if they are prone to founder, it could incite founder. So I just want to make sure that she is doing fine, which she is. Now we need to go to the other side, and we'll listen to her on the other side. You're okay, Mama. Munchkin's right here. Yeah, I know. There you go. There we go. Sniff on your belly. Okay, she's right here. She's right there. There you go. Okay. First time moms always want to be very protective. It's a good thing. Hang on, Mama. Did you hear anything? You're okay.
Good, Mom. Good, Mom.
Mare's got good gut sounds all the way around, so that's very good for her. And then the last thing I do is I just check her gum color, if she'll let me. Okay, she doesn't think that's a good idea. Hoping that's okay. Okay, Polly can come in. Now we're going to move on to the foal. And what we're going to do is we're going to keep the foal right in front of the mare, because the mare obviously is a little anxious, which is totally normal for a first-time mom. And then Paula, just bring her to the front of the mare. And then Abby, let her sniff on the foal. Which is fine. So the filly, we're going to do basically the same thing. We're going to listen to her heart, make sure she doesn't have a heart murmur. We're going to listen to her lungs to make sure they're nice and clear. We'll listen to her GI sounds to make sure she's got intestines that are moving. We'll take her temperature. We'll keep going from there. Hi, Mama. Heart sounds great. Lungs are nice and clear on this side. Now listen to the other side. They get to be a little wiggly. Okay, now we're going to take her temperature. Make sure she doesn't have a fever. Hold the bottom of the cup. She didn't think that was so fun. Okay. Spin her butt that way, and then hold the bottom of the cup. And so now what I do is I feel all over the filly. I just want to feel for any kind of swellings, any kind of excessive heat. Look at her baby. One of the most important things I do during this exam is I palpate all of her ribs. Want to make sure that she doesn't have a broken rib. It's not super common that foals break ribs during the foaling process, but it is common enough that it is something that you should check on every brand new foal to make sure they haven't broken a rib. The worst part about a rib fracture is that if it's in the front part of the rib cage up next to their heart, if they have a broken rib, it could potentially puncture their heart. So you want to be very careful to make sure that they don't have any broken ribs. And she does not. Okay, you're okay. I know, Mom. I know. Feeling the last of her joints. I put a glove on for this. I'm going to palpate her umbilicus. I want to make sure it's dry. Let her sniff the tail. Come on, Mama. There you go. That. Lots of. I want to make sure the umbilicus is dry. The umbilicus is the main way that bacteria can get into the bloodstream through the foal, and it's nice and dry for her, which is good. They get bacteria into their bloodstream, they could get very sick. The next thing I'll do is I'll palpate the roof of her mouth, and I'm looking for cleft palate. Okay, there you go. She does not have one. Cleft palates in foals are different than what they are in humans. You don't see it from the outside, you can only feel it. I'm going to palpate her head. I'm going to look at her gums to make sure she doesn't have a parrot mouth or a sow mouth, and she doesn't, which is good. I'll find her light. Hang on, Mama, you're doing fine. I just use a pen light. I look at their eyes. Want to make sure she doesn't have a congenital cataract. Her eyes look great. I also shine a light into their nostrils just to make sure I haven't missed any milk coming out through their nostrils, and then on her gums just to make sure that everything there looks good. Now I'm going to get a little blood sample so that we can test her IgG level. All horses are born without any kind of antibodies, and they have to get it through the passive transfer of colostrum from their mare. Colostrum is the first milk. It's very antibody rich, and we need to make sure that she has enough antibodies, so if she gets sick or gets exposed to something, that she has antibodies to fight off and not succumb to whatever it is she's exposed to. So that's what we're going to get some blood, and we're going to check that, and then we'll be all done. Hand up to her ear. Hang on, Mama. She you following? Yeah. Look over to him. I'm gonna move your front arm. You go with me. That position's your head. Little stick. Good girl. There you go. That's all. They both passed their exams, and right now they've got a good, clean bill of health and ready to be the next great racehorse. Right, Billy?
Someone just asked, is that why some are given a bottle right after birth?
Yes, sometimes people will give a bottle right after birth, before the foal even stands up, to ensure that they have a good amount of colostrum. Also gives them a little bit of boost, that they have a little bit of nutrition and some calories to help them get up and move around and nurse after that. It is, some people do it, some people don't do it, give a bottle before they give up. Get it.
Cool.